Hi, I'm Dr. Tim Jochen, and today we're discussing dermatofibromas on Best of Both Worlds. And I am being joined today by Brittany, our laser nurse, and Enedina, one of our fabulous back office assistants.
Okay, we have some questions. Our first question is, how do people get them, Brittany?
That's a great question. We are not completely sure. They don't really have a specific reason why they come, but they can come from...
Enedina?
There could come from an insect bite, a razor burn, just some trauma that occurred to the skin.
Okay, so I usually tell people the current theory is that they most often occur by an insect bite. That, you know how when you get an insect bite, it's red and then it gets swollen. Well, that swelling just turns into scar tissue and leaves the spot. Some people argue with me and tell me that that's not possible because they've never had an insect bite. In that case, any other kind of trauma could cause it, including a infected hair follicle.
Perfect. Next question. What do they look like? Let's start with Enedina this time.
Thank you. So the appearance of them can be very different depending on each person. They're usually a little bump. They're usually very firm. They can be very tender to the touch as well, a little bit itchy. The color changes per person. They can be pink, they can be a little bit red, a little bit hyperpigmented. It's always going to be different. That's why you always want to come to a specialist to go ahead and get that looked at.
And Brittany, what do you think they look like?
So they are typically small in diameter. I think that's what kind of sets them apart, right? Because they don't usually get very large. They stay a little bit smaller, maybe like about a pea size or a little bit bigger.
Okay. They're correct in all of these things. They look like little scars. If you pinch them, they have this characteristic of the dimple sign. And that means if you pinch around it, what will happen is the scar will go in a little bit, and that's a telltale sign. But they can be flesh color, they can be darker, or they can be red.
Okay, what are the treatment options for the dermatofibroma, Brittany?
Calling contour dermatology, of course. But also, when you come to see us, we will look at it and decide with you what is the best option. And I think the best person to talk about that would be Dr. Jochen.
And Enedina's going to go next.
Some of the few options we do, we have liquid nitrogen, we have kinolog injections we can do for them, we can shave it off, but you have the risk of it coming back. You can surgically excise it, although Dr. Jochen always likes to tell our patients, by doing so you are exchanging one scar for another scar.
Final answer?
The treatment options that we typically will do are observation, because in most cases it's very difficult to make this look better. We can do injections with kinolog to try to soften up the scar tissue and make it fade a little bit and shrink it a little bit. Some people will use liquid nitrogen to treat them, and that's where we take liquid ice and we freeze a spot, in theory stunning the collagen so it'll break up. But you know, that can actually lead to discoloration, ulceration, and things like that, so that's very rarely done. And finally, we can surgically excise them. But again, you're, like Enedina said, you're trading a scar for a scar.
Okay, and then our very last question, and most important, what is the aftercare treatment? Brittany, you want to lead us off?
Sure. So basically, you're going to want to treat it like any other wound. You're going to want to keep it clean, protected, covered, greasy. We like to put polysporin or aquaphor, depending, and just keep it out of the sun, which is...
You just want to treat it like anything. You fall off a bike, you scrape your knee, take care of it as you would that. Keep it clean, keep it greasy with the antibiotic.
Clean it with soap and water twice a day. Apply Vaseline or an antibacterial ointment, and if it's that is if we surgically excise it. Otherwise, you don't have to do anything to it. Today we're going to be injecting a dermatofibroma. All we're using is a little bit of steroid, kinolog, and what we're going to do is we're hoping that this will help to soften up the scar tissue. That's all there is to it. You inject until it turns a little bit white, and then we just put a little Band-Aid on. Once a month we'll do this treatment until Kelly is happy with the result.